Now, from your local source, TV20 News at noon in high definition.
Welcome back. Microsurgical breast reconstruction has become an increasingly popular option for patients in need of reconstruction after breast cancer. Our animated guest here today is here to talk to us about microsurgical options for women seeking breast reconstruction. So, good afternoon to you. Thank you for joining us.
Thank you for having me.
Thank you. This is Dr. Jason Rosenberg, and he's a reconstructive microsurgeon. Got you. With the Orthopaedic Institute, and he performs surgeries at the Orthopaedic Surgery Center and North Florida Regional Medical Center right here in Gainesville. So, once again, thank you for joining us. So let's actually get down to it. Microsurgical breast reconstruction, exactly what is that?
This is a procedure in which patients can use their own tissue, transplanting it from one part of their body to another to make a new breast after breast cancer surgery, a mastectomy, which is a complete removal, or a partial removal of a breast for breast cancer.
And exactly, what are the numbers? How many people end up using this?
Well, overall in breast reconstruction, only about 30% of people who have mastectomies will end up getting reconstructed. And that number, I think, is a little bit low. And the reason for that is that a lot of women don't know what their options are for breast reconstruction, so they don't know to look for it.
And how, who are the candidates for reconstruction, for breast reconstruction?
Well, the good news with that is pretty much all women are candidates for some type of breast reconstruction. Now, obviously, some women will choose not to be reconstructed, and they're happy to not. But for those who would like to have breast reconstruction, I would strongly urge them to come speak to someone who is a board-certified plastic surgeon who specializes in breast cancer reconstruction, who can lay out their individualized options for breast cancer reconstruction.
And what actually happens? What do you all do with breast reconstruction? How does that actually work?
Well, there are basically three choices. Women can either use implants, they could use their own tissue, or they could use a combination of those two to make a new breast for one that's missing after having had breast cancer.
And what do you all do for someone, particularly when you all do, you were telling me earlier that, what is it, a tummy tuck or?
Well, exactly. The DIEP procedure, or what that is basically transplanting tissue from the abdomen to the breast. Now, a lot of women will have a cosmetic tummy tuck and have that abdominal tissue just removed. But in people who've had breast cancer, that tissue can actually be put to good use by making a new breast out of tissue you would just discard if you were trying to get rid of some tummy tissue for a cosmetic procedure.
So this is good news for women who actually want to feel better about themselves.
Sure is. You know, the good news is that we're doing better and better in treating women with breast cancer. So more and more women are surviving much longer and doing great because we're catching it early. So they have a good, long, healthy life to look forward to. And in those patients who want to feel like themselves again and have an opportunity to have that breast back, we could do some amazing things.
And real quickly, because we have like a couple of seconds left, 30 seconds actually, what is the main message that you want to get out to everyone?
Well, I want women to know that if they want to pursue reconstruction after breast cancer, that there's an option for them. Obviously, number one thing is curing the cancer and having them do well long term, but there's options for almost everyone in making a new breast and getting on with their lives.
So it's also not falling victim to cancer.
Exactly.
All righty, thank you so much. We appreciate you being here and giving us all this insight. And you're going to be in St. Augustine tonight?
Going to be in St. Augustine tonight talking to a breast cancer survivor group there, yep.
All right, thank you so much. We appreciate it.
Thank you.
Thank you. And stick around, meteorologist Mike Potter will have a look at the forecast when we come back.